Policymakers should formulate plans that incorporate the poorest of the poor in our societies, so that interventions that could transform the smile are made available in selected health facilities. And my profound gratitude goes to everyone here who has come to listen to my journey.
Hi everybody, my name is Lady O and I am your host for today. If you haven't already, remember to like and subscribe this video and follow us across all our social media platforms at Bloomshare TV, Bloomshare Nigeria. Now today we are live at the Akindeko Auditorium, University of Benin, Ugbo main campus, for the 262nd inaugural lecture series to be delivered by Professor Mrs. Idia Ize-Iyamu. And today's topic is the magic of transformation. Blessed are ye who cry today, for ye shall soon laugh. Now follow us as we give you all the insights and the highlights of today's event, and we'll take you through, walk you through this wonderful location. Once again, do not forget to like and subscribe our channel and follow us across all our social media platforms at Bloomshare TV, at Bloomshare Nigeria. Thank you.
UNIBEN. If I take time to introduce everyone here to be another inaugural lecture. So I want to recognize everyone here present, and it permits me to just use your excellencies, because I see the former ex-governor in our midst here and other House of Rep and senators around. This must be one of the most attended inaugural lecture that I have seen. But I'll tell you what I will do. You will have to donate as you leave the door. So we will have people who will, I hope the ushers are around. It is not only when you go to church that you donate. You also donate for the development of the great University of Benin. And I see all my big daddies and emeritus professors all seated, elegantly dressed. And of course the royal are also here. Obagato Okpei. Thank you very much. It is my pleasure to welcome you all to the 262nd in the inaugural lecture series of the great University of Benin. Today's lecture is the 31st to be delivered in my tenure as the Vice Chancellor of this great university, and the 4th in the School of Dentistry, College of Medical Sciences. I am indeed very happy for all that you know, after 8 months, to inform you that the University of Benin has resumed fully. And the continuation of the second semester lectures has also commenced for the 2020-2021 academic session. and this commenced since Monday, the 24th of October 2022. I want to use this opportunity to solicit and to thank everyone for their cooperation, especially all stakeholders, in ensuring that we continue to enjoy smooth running and completion of this academic session. Ladies and gentlemen, the business of today. It is my pleasure to introduce to you our lecturer for today. She is our queen, Professor Mrs. Idia Ize-Iyamu. I chose my word when I said our princess, isn't it? The title of her lecture is The Magic Transformation. Blessed are ye that weep now, for they shall laugh. Professor Mrs. Ize-Iyamu was born on the 21st of June, 1969, in Lagos to the family of late Mr. Ode, of blessed memory, from Oredo local government area, and Mrs. Roslyn Ode from Orion local government area, both of Edo states. She completed her early education at Corona Nursery and Primary School, Apapa, Lagos, in July 1979. She attended and completed her secondary school at Holy Child College, Obalende, Lagos, in 1985. Professor Ize-Iyamu then proceeded to obtain her BDS degree in 1992 at the College of Medicine, University of Lagos. She did her housemanship in Louth from 1992 to 1994 and residency training in orthodontics at UBTH in 1997 to 2003. She was awarded the fellowship of the West African College of Surgeons in April 2004. She joined the services of the University of Benin as a lecturer 2 in 2003, and rose to the rank of a full professor in 2018. Professor Mrs. Ize-Iyamu has held several administrative positions within and outside the University of Benin, notably among them head of the Department of Preventive Dentistry from 2019 till date, member Postgraduate Committee, University of Benin, auditor Nigeria Dental Association, Edo State from 2012 to 2014, and vice chairperson, Nigerian Dental Association, Edo State Chapter from 2002 to 2012. She has also won several awards, such as the Best Head of Department School of Dentistry and Commonwealth Medical Scholarship. Mrs. Ize-Iyamu belongs to several professional bodies and associations, among which are Fellow, West African College of Surgeons, Fellow, World Federation of Orthodontics, Member, Nigerian Association of Orthodontics, Member, American Association of Orthodontists, and Member, Medical and Dental Consultants Association of Nigeria, UBTH branch. She has over 50 publications and scientific articles in peer-reviewed journals to date, and has attended several conferences and delivered papers in over 29 of such, both nationally and internationally. She has successfully supervised 4 postgraduate students. Outside academia, Professor Mrs. Ize-Iyamu has passion for cooking, reading, and writing. She is a Christian and married to Pastor Dr. Osage Ize-Iyamu, pastor in charge of Edo Province 16 of the Redeemed Catholic Church of God. The union is blessed with 4 children. Distinguished ladies and gentlemen, it is my pleasure to invite Professor Mrs. Idia Ize-Iyamu, a professor of orthodontics deliver our inaugural lecture. Members of the Governing Council, Vice Chancellor of other universities, IUO, BIU, and AAU, previous Vice Chancellors, Deputy Vice Chancellors, Registrar, and other Principal Officers of the University, the Provost, College of Medicine, the Dean, School of Postgraduate Studies, Dean, School of Dentistry, Deans of other faculties, distinguished professors, directors of institutes and units, heads of departments, distinguished academic and professional colleagues, other distinguished scholars and administrative staff, my fathers in the Lord, distinguished friends and guests, students of the University of Benin, members of the press, distinguished ladies and gentlemen, good afternoon to you all. I present to you the 262nd inaugural lecture series being given by me this afternoon, titled The Magic of Transformation. Blessed are ye that weep now, for ye shall laugh. My presentation content is highlighted on the screen, and I want to dedicate this lecture to the Lord God Almighty, who has been my rock and shelter and in whom I draw inspiration and strength from. I also dedicate this lecture to my late father, Felix Osande Ode, who did not live to see me become a dentist. My mother, Rosalyn Ode, who as a young widow, worked hard and sacrificed so much to see me through dental school. To my darling husband, Pastor Idia Ize-Iyamu, my friend, my prayer partner, my chief supporter, my encourager and critic, this will not be possible without you. To my children, Osasu, Osai, Isosa, and Osaho, thank you for your patient love and support in my educational sojourn. To my siblings and in-laws, thank you for your support and for cheering me on. The Vice Chancellor, it gives me great pleasure and a great sense of humility to stand here today to deliver the 262nd inaugural lecture of this great university. To a special day, as given a once-in-a-lifetime opportunity as a professor to share my research journey. It's the fourth inaugural lecture to be delivered from the School of Dentistry and the second from the Department of Preventive Dentistry. It is also a unique opportunity to showcase my journey from secondary school and the choice of a profession, which was dentistry. I have always loved dentistry because as a young, impressionable child, I was a dental patient who regularly visited an Indian dentist in the healthcare center near our house for management of my dental problems. His patience and care in always turning my weeping into laughter made me become a dentist, even in the absence of career and secondary school. I remember vividly feeling dentistry as my first, second, and third choices for JAMB without the knowledge of my parents. When I was given my admission letter to study dentistry, my mother asked me to reject it and to do JAMB again, as she could not imagine me looking at teeth for the rest of her life. But I was determined to study dentistry. Fast forward 6 years later, I graduated as a dentist and also much later trained as an orthodontist. I am now using the knowledge acquired to turn the weeping of others with dental problems into laughter. My introduction. The author, Maya Angelou, said, if you don't like something, change it. This is the fundamental basis for dentistry and orthodontics, which deals with that aspect of a person that you see first: the face, the mouth, the lips, and the teeth. The profession deals with the physical appearance of an individual, which even from the biblical days talked about how facial appearances, especially the teeth, the lips, and the mouth, denote beauty. Most people are concerned about how their face, the mouth, lips, and teeth are, and many are not satisfied with how they currently look. Many also do not know how to transform their facial appearance, their teeth, and their smile. And many seated here today are not aware that this transformation can happen, and how or where it can be achieved. The orthodontist deals with the transformation, and when this is done, it appears to be magic. Why the title of this lecture? The Vice Chancellor, magic has been identified as the power of apparently influencing events using mysterious forces. When used as a verb, it is defined as the ability to move, create, or change things. And transformation of a face and smile involves changing what you don't like about yourself
in order to improve your image and self-esteem using orthodontic forces. I projected this picture to one young man and I asked him, will you marry this lady? And he screamed, never. Why? Because a flawed or faulty dental appearance triggers anxiety in addition to low self-esteem and quality of life. Facial attractiveness improves the chances of marriage, job opportunities, and other things that you can do. And when a face is flawed, you begin to think that this person may not be who they are. So what is orthodontics? It is the study of the growth of the face, the development of the occlusion, prevention and treatment of dentofacial anomalies, and the placing of braces or small metals on the teeth of patients to correct scattered or malaligned bite patterns. The treatment is done for 2 years. I remember a young female youth corper who had braces placed in her mouth for her deranged teeth. And she was posted to a village in the northern part of Nigeria. The villagers ran away from her when they saw that she had something that looked like metal in her mouth and they believed that she was carrying something harmful. So she came back concerned that the braces might actually be harmful. I now decided to study the effects of the material, nickel chromium, that braces are made from on the oral microflora, and found out that there was no significant difference in what is in the mouth between those patients wearing braces and normal subjects. So in summary, wearing of braces is safe for the mouth and oral environment. I remember another chief, a prominent chief in Benin City, who came to the clinic, and we are going to place another material containing iron into his mouth. This chief was not ready to wear this metal in his mouth, Madam Vice Chancellor Ma, because he said he's a traditional worshipper, and that if we place metal in his mouth, it's going to prevent the effect of his medicine from gunshot and machete wounds. So we went to go and do a study. Our study on the cultural constraints on the use of dental implants and orthodontic mini implants in Benin City, Nigeria, Ize-Iyamu and Sahib 2019, showed that when it came to orthodontic appliances, which transformed the smile and changed the face, there was no inhibition. So this showed that for most people, they will wear whatever it takes to transform their smile, irrespective of their traditional beliefs. I'm going to show you a slide showing the different types of orthodontic problems that require correction. We have what we call the Brody bite. We have the crowding. We have skeletal class 3 and open bites, bimaxillary protrusion, anterior open bite and tongue thrusting habit, the lingual cross bite, the deep over bite, lower anterior arch crowding, restriction of the palate as a result of cleft lip and palate. An orthodontist. An orthodontist is a specialist who deals with and diagnoses occlusions, malaligned teeth, overcrowded teeth, and places these braces in the mouth. An orthodontist corrects the position of a tooth from an unfavorable one to various types of malocclusion that we see in the mouth. We'll look at the milestones in orthodontic history. From ancient times, right from the Holy Bible, teeth were considered to be important and recognized 50 times in the scripture. The ancient Egyptians, Phoenicians, and Etruscans undertook treatment for dental irregularities. Hippocrates wrote, but he emphasized the teeth. He said those people who have teeth arranged in an irregular fashion, one who was a French dentist, laid the foundation for modern orthodontic science and published his work on the use of a rudimentary orthodontic expansion device called a bandlet. Fast forward to the 19th century, the first book entirely devoted to orthodontics has the ability to create 3D images of the teeth was introduced. The CAD-CAM and robotic wire bending technology was introduced, and clear aligners, also known as Invisalign, was introduced into the market in 1998 and became an alternative to traditional braces. So in summary, orthodontic timelines have evolved with newer, faster, and more mouth-friendly appliances available for the correction of crooked teeth. If we look at the development of the orthodontic profession in Nigeria, it began with my professor who is sitting here in the crowd. I greet you, sir, Professor M.C. Isikwe. He's the first orthodontist in Nigeria, and he was trained at the Royal Victoria Hospital, Belfast in the United Kingdom. When he returned to Nigeria in 1979, he began teaching orthodontics in 4 dental schools, namely Benin, Ibadan, Ile-Ife, and Lagos. As a student, privileged to meet Professor A. Anderson as an international exchange student in 1991 in the Queen's University of Belfast in the Republic of Ireland, and also the famous Professor C.P. Adams, renowned for developing the Adams class used in retention of removable appliances. This exchange program was facilitated by the then Dean Faculty of Dentistry, Professor M.C. Sikwe. It was his passion for the specialty that inspired me to become an orthodontist and the knowledge that I have today. Orthodontic training in Nigeria. To become an orthodontist entails postgraduate training after 6 years of dental school. 2 colleges train this specialty, namely the West African College of Surgeons and the National Postgraduate Medical College of Nigeria. The process involves qualifying to enter the residency training program through an exam, the primary exam. After passing the first exam, the candidate undergoes clinical rotations in medicine and dentistry for 2 years, and then the second exam, the part 1, is taken to move fully into the orthodontic training program. Orthodontists in Nigeria. The current population of people in Nigeria is estimated to be 206 million as at mid-year 2020, according to the United Nations data. We currently have 70 orthodontists serving 192 million Nigerians, a ratio of 1 orthodontist to 2.7 million as at 2019. These 70 orthodontists in Nigeria, 10 are professors of orthodontists in Nigeria, 4 are in Lagos, 3 in Benin, 2 in Ile-Ife, and 1 in Port Harcourt. So there's a shortage of this specialty to train people. So when we look at the orthodontic specialty in Edo State, we have currently a total of 6 trained orthodontists. 3 are professors of orthodontics in Benin City, Edo South. 2 consultant orthodontists also in Benin City, Edo South. 1 consultant orthodontist in Irua, Edo Center. And there is none in Edo North. The current number currently serves a population of 3.2 million and represents a ratio of approximately 1 orthodontist to 539,000 people. Bearing in mind the small number of specialists in Benin City, it was important to detect the prevalence of early onset of malocclusion to prevent and allow for intervention. We assessed malocclusion using the CISA classification as an epidemiological tool which was fast and easy to use, and was able to detect those children that will require treatment later on. Ize-Iyamu and Uweni, 2006. During my training as a resident doctor in UBTH, we were only 2, Dr. and Mrs. N. Folaromi and myself, who are now specialists. I remained in the hospital, and younger residents, now specialists, came into the program, and include Dr. Terence, Ahimie, Uzamere, Aburime, and Osemige. My role as supervisor and mentor for the postgraduate dissertations of Dr. Godi, Ahimie, Uzamere, Aburime, and currently Dr. Olubamiwa, humbled me as to the responsibility of nurturing the next generation of specialists for our state and beyond. More residents are currently in training, and with time, the specialty will improve, barring brain drain, to improve the low doctor-to-patient ratio. Now, what's the etiology of malocclusion? The etiology of malocclusion is the study of its causes. It is the recognition and identification of the factors that cause the face, teeth, and smile to be crooked. Malocclusion and traits with various problems were identified in Benin City, Idia Ize-Iyamu, 2010, and we found out that this kind of problem, which we call the increased overjet, is prevalent in 43% of children. We found out that the increased overbite, whereas the teeth appear to be longer and is termed rabbit teeth, was seen in 25.2% of children. The anterior open bite, where the front teeth do not meet together, was seen in 8.4%, and the posterior cross bite in 12.2%. We found out that malocclusion affects both healthy children and those with special needs. Our study on the prevalence of malocclusion in children with Down syndrome showcased that this group of children with special needs, when compared with normal children, had a significantly higher prevalence of problems with the bone and teeth. They could also be affected by the same etiological features as normal children. Ahimie, Ajayi, and Ize-Iyamu, 2021. These factors causing malocclusion may be local or general factors, and they affect both normal and special babies with mental or physical disabilities. A special group of children known as the cleft lip and palate babies are also affected by these soft tissue problems. A confident smile begins from childhood, and the lips play an important role in the formation of a smile. And the lips of these special babies, these cleft palate babies, are defective, resulting in stigmatization, regret, and weeping by parents and caregivers of this special group. Most parents of babies born with these congenital defects greatly desire a transformation, as weeping follows the shock of such births. Ize-Iyamu et al. In a study in Benin City on the knowledge and attitude of parents concerning children with cleft lip and palate found that at a large percentage, 74%, had not heard of this condition. Ize-Iyamu et al. 2018. 73% of mothers were ashamed of such babies. Idia Ize-Iyamu et al. 2016. They recorded shame, being treated as outcasts, the work of evil spirits, and then the refusal of parents, friends, and caregivers to carry such children. The summary and conclusion of their research was that myths surrounding the of orofacial cleft are prevalent in Nigeria. Parents and individuals with cleft lip and palate experience stigma as well as societal and structural inequalities due to societal perceptions and misconception about cleft lip and palate. The question is why? Such parents were extremely sad and unhappy that the lips of such babies were cut and the children appeared unattractive. A worker heard that a strange and evil baby had been born in that community, and she went to investigate. She was shocked to see a malnourished baby with a bilateral cleft lip and palate and brought them to UBTH for evaluation. The mother was depressed, weeping, and the mother-in-law followed. The statement that came out from the mother's mouth was, "Is this a child?" The biggest challenge was to encourage them that this child could be transformed. The next question the mother-in-law asked in vernacular, "Na magic? How you want to change this one? Abeg, let am die." That statement tore my heart to pieces, and they refused to breastfeed the child as it was very difficult because the child kept on aspirating and spilling the food. I now went into research and invented a method using a very cheap and affordable method for our environment, as all previous research methods were unavailable and expensive when the cost was converted to naira from foreign currency. How will the poor people afford it? The Vice Chancellor, my study feeding intervention in cleft lip and palate baby, practical approach to feeding efficiency and weight gain, Ize-Iyamu and Sahib 2011, was published in the International Journal of Oral and Maxillofacial Surgery in 2011, and it won me a Commonwealth Medical Fellowship in 2015 to 2016 to study craniofacial orthodontics at the Oxford University, United Kingdom. We found out that cleft lip and palate babies fed with this modified method had a faster feeding time, less spill and regurgitation, and gained the same weight as normal babies at 10 and 14 weeks. This method is practical and cheap and is readily available for all socioeconomic groups. This feeding method has today been referenced widely and is also part of the clinical guidelines for cleft lip and palate in one of the European countries. This is yours truly, feeding one of our special babies in the clinic. Cleft babies who are underfed develop non-nutritive sucking habits which may be detrimental to the mouth and teeth. The effects of these digit sucking habits on the premaxilla, which we can see on this slide, sorry, my pointer is not working. It shows that it causes the premaxilla to be protruded, as seen in the second slide, Ize-Iyamu, Sahib, and 2010. If these habits are not discontinued early, it worsens the problems of the lips, bone, and teeth. These cleft lip and palate babies may also have deviation of the nose. A majority of the patients presenting with this condition are from the lower socioeconomic groups, the poor, Idia Ize-Iyamu 2015. Majority of those presenting to the clinic have lost hope, and I decided to work out a cheap, easy, and practical method. So I designed a bonnet with elastics and an acrylic cap, or in some cases hooks, to help retract the bonnet or sticking out bone, also known as the premaxilla, with a budget of only 500 naira. Or less than $1. These cheap appliances have effectively stopped the sucking habit, pushed back the bone, the premaxilla, aligned the bent lips, and made the flattened nostrils more patent. The residents in the orthodontic clinic nicknamed this baby bonnet appliance the Idia bonnet, and surgical repair has resulted in a favorable outcome. Madam Vice Chancellor, with as little as 500 naira, a smile is transformed initially with a better surgical outcome. Etiological factor in malocclusion is retained baby teeth. The orthodontist deals with correcting malpositioned teeth, but the child that is transitioning must lose the baby teeth, which are replaced by permanent teeth. These primary teeth may be retained beyond the time they are still needed, resulting in both primary and permanent teeth being in the mouth at the same time and causing an unsightly smile. My study Ize-Iyamu 2011 on the prevalence of retained primary teeth among children with anterior arch crowding elucidated this fact. Other factors include permanent teeth failing to erupt in the front of the mouth, leaving a space and an unsightly smile. This can be managed orthodontically, and a case report of such was reported Ize-Iyamu 2013. Crowding of the arch can distort the way the mouth looks, and this was shown in our study, Ize-Iyamu 2020, whereby the arch form is distorted as the teeth are deranged from their normal positions. Soft tissues and malocclusion. Some soft tissues in the mouth can cause malocclusion, and a prominent one is the thick fibrous band which passes between two teeth, usually in the anterior region, and displaces the teeth, resulting in an unsightly smile. This abnormal fibrous and thick tissue is called a frenal attachment and is one of the factors implicated in the etiology of malocclusion. The low attachment has to be relocated, and another way of doing this is through laser surgery. Our article, Ize-Iyamu, Sahib and Edentale 2013, was done on soft tissue lesions and is the first laser surgery carried out in orthodontics in Nigeria. So we see how we have relocated the frenal attachment with the use of the lasers. Coincidentally, there is no bleeding, and we put our orthodontic appliance and we're able to correct the malocclusion. Madam Vice Chancellor, ma'am, it might interest you to know that when the anterior teeth fail to meet together in a vertical relationship, it is termed an anterior open bite and can be seen in both children and adults. The subject of my thesis for the award of fellowship in orthodontics from the West African College of Surgeons in 2004 assessed the prevalence of this condition, anterior open bite, and its associated etiological factors, Ize-Iyamu 2004. Another study on the prevalence of anterior open bite in children, Ize-Iyamu and Isiekwe 2012, showed that this condition exists and the actual vertical gap can be as much as 4 millimeters. The factors that could cause it include digit sucking, tongue sucking or thrusting, or other medical conditions that affect the tongue. And when this happens, the patient has speech defects and could be a source of aesthetic and psychological problems. We studied the challenges such patients face, Ize-Iyamu and Otaren 2021, and 4 were identified. This included the inability to bite with the front teeth, speech disturbances, tongue thrusting, and problems with the temporomandibular joint. And most patients with problems with their bites will not smile. The picture you see before you is a patient who had an anterior open bite. We put our orthodontic appliance and we changed the smile. Teeth and malocclusion. Some patients have more teeth than the normal complement given by God, and these are known as supernumerary teeth. They make the mouth appear full and busy, and this affects the smile. These teeth are common in our environment, and our study, Ize-Iyamu, Otaren, and Uzamere 2016, identified variants, as can be seen in this CBCT X-ray on the side, for both anterior and posterior teeth. Some teeth remain within the bone, distorting the configuration of the face, especially the canines, which are the pillars of the face. Absence of these teeth could result in the premature aging of the face, and hence a sad smile. We, Osagona and Ize-Iyamu 2017, reported 2 cases of bilaterally impacted mandibular canines and how they were managed to transform the faces of these patients. Other clinical cases we saw, Ize-Iyamu, Osagona and Erabo 2016, where anterior teeth lying horizontally and in an unfavorable position within the bone. Hope was lost, but we were able to auto-transplant these teeth and orthodontically align them within the face. This appeared to be like magic as the smiles were transformed. We have a young man here who presented with multiple teeth in his mouth. We placed our orthodontic appliance, and you can see the magic of transformation in that smile. Trauma and its effect on malocclusion. Trauma could cause teeth to be lost completely from the mouth, and this is called avulsion. Our innovative approach to teeth loss from the mouth for 3 days, replaced and orthodontically corrected, was reported. Ize-Iyamu and Sahib, 2013. A 14-year-old boy walked into a glass door previously and lost his 2 front teeth. Hope was lost. When they came to the clinic, we asked for the avulsed teeth, which the mother said was thrown away. We asked if those teeth could be found, and they were brought, but they were dry and dead. We were able to successfully reimplant those teeth and followed him up successfully. The magic was the transformation from more teeth in the front of his mouth, replacement of an orthodontic appliance, and teeth in its mouth. Trauma could also be worse if certain problems exist with the front teeth. And this is when there is shooting out of the front teeth, and the value should be between 2 to 4 millimeters. Patients with a value of more than 7 millimeters are more prone to fracture and avulsion of such teeth. Idia Ize-Iyamu and Adeniyi, 2019. This led to a 10-year audit of traumatic dental injuries, which confirmed the fact that certain types of dental arrangements or malocclusion contribute to more severe forms of traumatic dental injuries. Idia Ize-Iyamu, 2020. Madam Vice Chancellor, it is clear that certain dental arrangements not only cause problems with beauty, but also make such patients prone to trauma of these teeth. Beauty is in the eye of the beholder. The people of Edo State are renowned for woodwork and bronze casting, which depicts photographs, stories, and information of events at a particular time of their history. The woodwork depicted above is estimated to be about 80 years old, and the story depicts severe malocclusion with the upper and lower teeth protruded and also an open or gap tooth, which is aesthetically unacceptable to the orthodontist. This was, however, a sign of beauty. Hence, the sculptor decided to make it an object of history. Remember that only what was considered beautiful was carved then. Beauty, they say, is in the eyes of the beholder or the carrier. Some people actually believe that their teeth should have a certain appearance and often go to quacks to modify the teeth to meet their expectations of such beauty. One of such alterations are done on the anterior or front teeth to create an artificial open teeth, gap tooth, or midline diastema in dental parlors. Some cultures actually take it as a sign of beauty. My study on this subject, Ize-Iyamu 2015, found out that open teeth is regarded as a form of beauty, and gaps are acceptable even up to 6 millimeters in our environment. Open teeth greater than 7 millimeters were now considered unattractive. Beauty, they say, is indeed in the eyes of the beholder. I present to you a patient who felt that her diastema was unattractive, who placed the orthodontic appliance, and we transformed the smile. Bones and malocclusion. The skull houses and protects the brain and supports the other soft tissues of the head. And the basic step in transforming a smile is to examine the bones, and this is best done with cephalometric radiographs, which we can see here in this picture. It is used as a diagnostic tool to identify certain anomalies. On this radiograph, certain structures are useful and include the sella turcica, which is this black circle that we see on the other X-ray. The importance of the sella turcica, which is a saddle-shaped cavity in the skull in orthodontics, is that it plays a major role in cephalometric tracing and in the determination of the type of skeletal malocclusion. In order to get it right, I studied the sella turcica in 3 types of jaw relationships, the class 1, class 2, where the upper jaw is far ahead of the lower jaw, and the class 3, the lower jaw being far ahead of the upper jaw in Benin City. When I discovered that the sella turcica shapes and types vary differently in the 3 skeletal classes, with the class 2 being the more predominant skeletal class. The Vice Chancellor, I recollect a young girl who with this type of malocclusion, who after I corrected this anomaly, was transformed. Such was the magic of this transformation. With tears in her eyes, she said, "You have made me look like a beauty queen," and went on to contest in the most beautiful girl in Nigeria and came second. Such was the magic of this transformation. I present to you patients that have this type of class 3 malocclusion and how it appears in their mouth, orthodontic placement, correction, 16-year-old, 17-year-old patient who also had this type of strong face. And in addition, an open bite, we placed the orthodontic appliance before and after. We also present older patient, a 57-year-old who presented with this kind of malocclusion before we placed the orthodontic appliance and after. Bimaxillary protrusion. The Vice Chancellor, a common orthodontic problem in Nigeria is when both the lower and upper bone push forward, a condition known as bimaxillary protrusion. Isekwe 1990, Ize-Iyamu 2018. It is also diagnosed by the use of cephalometric radiographs. Most patients present complaining of buck teeth, inability to close the mouth, and a very unattractive smile. The Misella toxica is also useful in determining the orthodontic problem for such cases. My study on bimaxillary protrusion obtained the values for orthodontic patients in Edo State, Ize-Iyamu 2018. This is this patient and how he presented initially. We corrected the problem orthodontically, and this is him at 21 years of age. X-rays and malocclusion. X-rays are part of the diagnostic tools utilized before the treatment of the scattered teeth commences. And the cephalometric radiograph may be 2 or 3 dimensional is utilized. It shows the underlying problem with the bones, soft tissues, and the airway. I recollect a patient presenting to the clinic with a story of how witches and wizards were pressing him down at night, and he felt as if he was drowning. This was part of the summary of his complaints, apart from the orthodontic problem. 2016 on the pharyngeal dimensions in orthodontic patients. The study brought about the current Nigerian values for upper and lower airway in Nigerians, and subsequently these airway values are taken into consideration and utilized when managing patients. Suffice it to say, that after management of this particular case with braces, the upper and lower airways were expanded with combined orthodontics and periodontics, who were able to change her weeping to laughter, as evidenced by the very confident smile at the end of treatment. This is the magic of transformation. I present to you our patient with the teeth. We placed the orthodontic appliance, periodontology came in, and this was her after. What is the right time to seek treatment? The ideal age for orthodontic treatment is 7 years of age. The anterior cross bite, with what you see here, is best treated between 7 to 10 years of age. The deep bite is best treated between 6 to 13 years of age, and severe problems can be treated at any age. Lampasky and Nanda in 2002 determined the treatment timing in Americans based on the shape of the cervical vertebrae. These are the bones of the head and neck at different ages. The shape of these bones change when a child attains puberty and also when growth has stopped. This method is effective in catching age cheats. As a story was told of a footballer who claimed to be under 17, but when the cephalometric radiograph was taken and the bones of the head and neck, the cervical vertebrae, were evaluated, it showed that he was over 17 years of age. The Vice Chancellor, I decided to find out the optimal time for treatment of orthodontic patients in Nigeria, as no other study had been carried out on it. Ize-Iyamu 2013, Ize-Iyamu 2014. My results showed that bimaxillary protrusion, which is this kind of severe case, is best treated at 14 years of age, or when the bones in the head of the neck are in what we call the stage 4. I also found out that the skeletal class 3 is best treated at 11 years of age, or when the bones are in cervical stage 3. Facial growth reduces but has not stopped after the age of 15 years in both male and female. But however, orthodontic treatment is still possible. By 18 to 21 years, growth is at its lowest. But this does not stop adults from treating their malocclusion. However, more of camouflage treatment is done rather than orthopedic treatment, which occurs in younger children, Mazzini 2017. The summary of this is that no matter your age, it doesn't matter how old you are, most malocclusions of the teeth can be rearranged with braces, except the underlying problem requires surgery. And this is how the bones of the neck look like. The optimal time for treating class 3, class 2 is 11 to 14, class 3 before 8 years of age, transverse discrepancies 8 to 11 years, and increased vertical dimensions 11 years of age. The right time is when you decide. As the author Maya Angelou said, if you don't like how your teeth are, do something about it. Change it. Psychological problems. Malocclusion is perceived differently by other people, as beauty has been described as being in the eyes of the beholder. It therefore follows that orthodontic evaluation must consider the patient's perception and the different aspects of life, which includes the cultural perspective and self-esteem. Some individuals with severe malocclusion may be satisfied or indifferent to their dental malocclusion, while others may be sensitive to minor irregularities. I'm going to present to you some pictures in the magic of transformation and the blessings in laughter. I present to you this 41-year-old man. In fact, he told me I should post this picture on social media. I should not blind his face, but I said no, I will blind his face. And this was him before and after. Another 41-year-old patient who came, not liking how her smile was, who put the orthodontic appliance in because a quack had already spoiled her front teeth. And this was her before, and this was her after. Acknowledgements. Madam Vice Chancellor Ma, as I conclude this lecture, I wish to acknowledge the Almighty God, the Alpha and Omega, the beginning and the end, the one who transforms all things and makes them beautiful in his time. To him be all glory on all he has made me to be. My special thanks goes to the present Vice Chancellor, Professor Mrs. Lillian Salami, for the opportunity to showcase my journey in academia and deliver this inaugural lecture. My sincere gratitude goes to my loving parents, my father, Felix Osayede Ode of blessed memory, a perfect, well-educated gentleman who believed in education to the highest level. It is unfortunate and sad that he did not live to witness my graduation from dental school and the inaugural lecture of today. May his kind and gentle soul continue to rest in perfect peace. I salute my mother, Mrs. Rosalind Ode, a dogged and strong woman, a believer in her children, and a friend of the poor and homeless. Thank you for teaching me that women must be hardworking and high achievers in all their endeavors. May you live long to enjoy the fruits of your labor. I appreciate my siblings and their spouses, Mr. and Mrs. Omo and Adesuwa Karo, my brother Barrister Helsuo and Lakba Ode, Mr. Idehe and Yemese Ode, Dr. Sayawa Ode. I appreciate the Ode and Aimiwu family represented here by my darling auntie, Chief Mrs. Rita Ogunto Imbo, my nephews, my wonderful in-laws, the Ize-Iyamu family and their spouses. May the Lord God Almighty continue and keep you all always. Lagos, my sincere appreciation goes to my lecturers as an undergraduate dental student at the Faculty of Dental Sciences, University of Lagos, Professor M.C. Isekwe, the father of orthodontics, who was a great mentor, a teacher and a sponsor. Together with his late wife, Mrs. Anne Isekwe of blessed memory, they were sponsors of my wedding, and he has encouraged me to train as an orthodontist later on. He taught us compassion, generosity, and selflessness to others. I also want to acknowledge the role of my trainers in my postgraduate years, Professor M.C. Isekwe also, Professor Da Costa, Professor Utomi, Professor Shanu, who accepted me in their institution, and also appreciate my big sister and friend, Professor F. Oreduba, the current chairperson, Faculty of Dental Surgery, West African College of Surgeons. I appreciate my colleagues and friends, Dr. Nachita and Dr. Anosike, fellow supernumerary resident doctors in Louvre when I was in training. I'm grateful to the authorities of the University of Benin and the University of Benin Teaching Hospital for the support, opportunity, and privilege given to me over time in my academic and clinical career. I'm grateful to the past CMD of UBTH, Professor A. Obasoha, for approving and sponsoring my external training for 2 years as an orthodontic resident to the Faculty of Dental Science, College of Medicine, University of Lagos. I'm grateful to the former Vice Chancellor, Professor O. Oshodi of blessed memory, for supporting my Commonwealth Fellowship Program in craniofacial orthodontics to the Oxford University in the United Kingdom. I appreciate the past DVC, now the current VC of Igbenedion University, Okada, Professor Zemoye, for believing in female medical training and encouraging me during my Commonwealth Training Fellowship in the United Kingdom. I also appreciate the immediate past VC, Professor F. Oruwese, for announcing me as a professor in orthodontics effective October 2018. I am most grateful to a dependable mentor, a friend, and a father in the dental profession, Professor B.D. Said, who taught me how to write as an academic, a great encourager and a supporter. I salute you, sir. I appreciate the immediate past dean of the School of Dentistry, Professor M. Sede, for pushing my papers for promotion as a professor of orthodontics. I acknowledge the present dean, Professor O. Omorige, other members of the School of Dentistry, too numerous to mention. I thank all the academic staff from other faculties, with special reference to Dr. Dumebi Kayoma, for your selflessness and friendship. I appreciate all non-academic staff, most especially Pastor M. Owie, for your invaluable assistance. I appreciate the past and present resident doctors, especially Dr. Esther Uzamere, now a consultant, an adopted daughter and friend, past and present students, all of you. My story cannot be written without you. I say thank you. I'm grateful to my friends and partners in Shalom Dental Clinic. I am also grateful to my fathers in the Lord, the General Overseer of the Redeemed Christian Church of God, Pastor and Pastor Mrs. E.A. Adeboye, my immediate past regional pastor, now Sadgo admin and daddy, a fellow professor, Professor and Professor Mrs. Dele Balogun. To my provincial pastors and members of my parish, the Redeemed Christian Church of God, Edo Province 16, I say thank you all. I acknowledge the love and support of the late Captain Osa Wells Okumbo. May his gentle soul rest in perfect peace. I also appreciate the support of my husband's longtime friend, Chief Dr. Lee Ipia. To my children, Barrister Osasu Ize-Iyamu, Osayi, Aisosa, Osaho, I thank you for your love, patience, understanding, and commitment to my career, especially when I was away for training. Thank you for being my friends and gisting partners. I give all the glory for you all. I pay special tribute to my loving husband, my friend, my prayer partner, my soul of my life, one of my bones, my loving husband, Pastor Dr. Osage Ize-Iyamu. You have been there for me from residency, when I had to leave you with our 3 children then to go to Lagos for a 2-year training program in orthodontics. I was also away in Oxford University on a Commonwealth Fellowship program, and you were so supportive and encouraging. You supported me wholeheartedly, and men like you are indeed rare to find. Without your encouragement, generosity, love, and support, I will not be who I am today. Your patience and determination to see me through has yielded the required results today. Your encouragement through the journey of burning the midnight oil in reading, research, and writing papers is something that I cherish always. Thank you for the sacrifices and the love you showered upon me. Thank you, the love of my life. I appreciate you greatly. Recommendations. Madam Vice Chancellor, in view of my humble experience, hospital should be free for such children to encourage those who are hiding as a result of shame and inability to afford the cost of treatment be attended to. Policymakers should formulate plans that incorporate the poorest of the poor in our societies, so that interventions that could transform the smile are made available in selected health facilities. This should include orthodontic treatment for patients with cleft lip and palate, and for those with severe handy malocclusions that could affect their social and mental states. Funding should be made through special interventions for this special group of patients. Training should be included for craniofacial orthodontics so that the manpower needs in this area will be increased. Malocclusion can disfigure an individual, but it can be corrected. Education via advocacy, town and gown meetings, campaign and awareness programs on the availability of specialists to treat this problem should be done to reduce self-help and quackery. Career talks should be carried out in primary and junior secondary schools to enable children choose their career pathway early. This would encourage young children making a choice of dentistry and subsequently orthodontics as a career path. In conclusion, the face and smile is an important part of an individual, and transformation is possible with the help of an orthodontist. The teeth may be crowded, spaced, malaligned, or in a state that gives poor self-esteem. Those factors that cause these problems, they can be rearranged to a normal or acceptable position. This brings about a transformation that appears to be like magic. Ecclesiastes chapter 3 verse 4 states that there is a time to weep and a time to laugh. The time of weeping is when malocclusion abounds, and the time to laugh is when the malocclusion has been corrected, giving you a great smile. Therefore, I summarize, in the magic of transformation, blessed are ye that weep now, for ye shall laugh. Finally, what you don't like about your smile, change it and improve your smile, your self-esteem, your self-confidence, and your personality. For this opportunity, and my profound gratitude goes to everyone here who has come to listen to my journey with patience and love. Thank you all. I wish you safe journey to your various destinations. God bless you.
I told you she was bright and she was the open teeth. We thought it was something of beauty, isn't it? Some of us even went looking for dentists then to open so that we can look prettier. So we can look prettier. But I thank God, God still created me as a beautiful woman. Thank you. So we actually thank the lecturer, Professor Mrs. Idia Ize-Iyamu, for delivering such an informative lecture. And of course, for giving a good account of her extensive contribution to the profession. The lecturer described orthodontics as a specialty that transforms the face and smile of children and adults with different formations. She gave a historic background and a progressive from century to century profession has grown.
As the Vice Chancellor decorates her, and then I crave the indulgence of the Vice Chancellor. It's a star-studded house, as we all.
Magic transformation, and you need it, or you already have it. Thank you.
Well, the truth of the matter, she has said it all. If you want to smile well, then see an orthodontist. Thank you.
Very, very rich, and I like it. What else can we say other than it was a pretty good lecture?
This is one of the most interesting inaugural lectures that I've listened to. Quite rewarding for society because of the challenges that a lot of people have had with their dental configuration. She has been able to let us know that those problems can be corrected. It's quite a great accomplishment, and everybody is pleased about the lecture that was delivered. And so society can now begin to look forward towards correcting such problems and begin to laugh again as well.